Joining us in the studio for this week's Your Health segment is Dr. Kelley Banagan, Assistant Professor of Orthopaedics at the University of Maryland School of Medicine and Spine Surgeon at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thanks for having me.
We want to focus on scoliosis, which I remember as being something that they always check kids for.
Correct.
What is it?
Scoliosis in the broadest base sense is a curvature of the spine. So most people would consider it an S-shaped curve if you look at it on a radiograph. It's actually a three-dimensional problem. So the spine's not just twisting or the S that you see on an X-ray. It's actually rotating as well.
All right, here's an X-ray of a obvious curvature.
Correct.
Now, the spine normally curves a little, I guess, in the opposite vector.
Excellent point. So this is what we would call an AP or a PA radiograph, meaning you're looking at it straight on, the spine straight on. So this is a front view. There should be no curvature on a front view. The curves you're referring to are from a side profile. So normal curvature, neck, area of the spine around the rib cage, and the low back on a side view is totally normal.
What happens if you go through life with a spine looking like that?
Plenty of people do, actually, all the time. We don't tend to operate on scoliosis. That, I should point out, is a teenager. So the most common scoliosis that we're going to talk about today and that I see in the office is adolescent idiopathic scoliosis, meaning it affects the teenage population, generates out of nowhere. There is a genetic component, but most of the time just happens out of the clear blue sky and affects teenagers.
So this is somebody who was okay and normal spine at age 10, and then something in that big growth phase went off course?
Correct, exactly right. So there are other types of scoliosis, so congenital, meaning the child is born with it, secondary to an abnormality in the spinal column, juvenile, affecting a younger age group, and infantile as well. Adolescent idiopathic scoliosis just arrives as out of the clear blue sky. Tends to run in families, genetic component that we're not quite yet super great at detecting, but...
And doesn't resolve itself at some point?
Does not. Great question. So no, it doesn't. And we tend not to intervene until the curve reaches a certain magnitude or degree of curvature. There's plenty of people walking around all over the place that have curves in their spine that you'd never know, that we've never done anything about. Yeah.
Any idea if you did an X-ray of 100 people out there, how many of them would just an amateur be able to detect some curvature?
If you look at someone carefully, if you have a trained eye, you can tell. Female trimmer people, obviously easier to detect, tends to show an imbalance second to that rotation deformity we were just talking about in their scapula. So the wings in the back of your musculature will show a little bit of asymmetry. Collarbones can be affected, and pelvis also. Tends to affect less than 10% of the population.
So it's something you can't do anything to prevent this?
Correct, no.
And then in terms of treatment, do you have options short of surgery?
Tons of options. So unless the curve reaches a certain, we measure them in angles, unless the curve reaches a certain angle, we don't do anything but observation. So that tends to be approaching 25 degrees if the child is still growing. So the thing about scoliosis is the curve grows as the child's growing, secondary to growth plates in the spine. If the curve is still growing, because the child is still growing, then we brace them if they approach about 25 to 30 degrees. If the curve approaches a higher magnitude, 45 to 50 degrees is when we talk about surgery, and anything less than the 25 we observe.
Your media folks sent over two X-rays. It was the first one we had up with the curve, and then the second one showing a corrected spine with an apparatus on it that looks awfully involved in terms of the surgical procedure and maybe not comfortable either.
Point well taken. So this is a rod and screw construct. So the screws go into the vertebral body themselves. That spans this particular patient's entire spine because both curves were considered needing to be operated on. Essentially, the screws and rods act as an internal brace or strut to hold the spine in its corrected position while the body's doing the work. So it becomes one solid block of bone or a fusion over time.
Is something then removed, the rod, or it just stays there?
Hopefully we never revisit that ever again. No, they stay put. They stay put unless there's some sort of reason to revisit.
Let's take a phone call. This is Carol in Washington, D.C. Carol, thank you for calling. Go ahead.
Hi, again, I'm Carol, and I'm watching your show. I have a scoliosis. I was born with it. But I notice now that I'm older, I'm 58 years old, I see now that it's curving more to my right side. It does not hurt, but I was just wondering, but it's very pronounced. So if I put on a top of something, you can actually see how it protrudes. And I just noticed it within the last year or two that was happening. So is there anything I can do other than surgery to correct, or at least, even if it's not going to be corrected, to stop it from curving any further?
Great question. So classic old school teaching used to be that scoliosis didn't progress beyond the growing years. We now know that to not be true.
I just found out a couple of seconds ago.
It can progress up to 1 degree a year.
Wow.
So getting regular radiographs, even once people reach adulthood, is a good barometer to know what's going on with your spine. The surgery is a much bigger deal for adults than it is for adolescents. They tend to rebound much quicker. For adult patients with scoliosis who don't want to undergo a massive surgical procedure, things like physical therapy, active exercise will not modify the appearance but can help the symptoms.
You brought a model spine with you. Why is it so problematic in so many different ways? I mean, there's all these back conditions we haven't talked about. It's obviously a really complex thing.
Yeah, it's complex and simple, right? Nothing's really changed about the spine in forever, in decades.
Since we started walking upright, I guess.
Correct. And we're constantly developing what we think to be new and better surgical techniques or practices. But I think that a lot of back pain in the adult population is truly the black box of medical management. We don't truly understand it as best as we could.
Are we making progress?
Hope so. I think that the more we understand about the body and pain generators, we tend to be able to tackle those from different avenues better.
Let's talk to Gail in Sussex County, Delaware. Gail, thank you for calling. Go ahead.
Yes, my grandson has been through a great growth spurt, and he's only 12 and a half, but he started to bend over a lot. Does that have anything to do with scoliosis?
Great question, Gail. That's actually, you mean when you look at him from the side, that is called kyphosis. So the area around the spine, around the rib cage, can actually develop a forward curvature called kyphosis. And yes, sometimes those are linked. Scoliosis and kyphosis can be linked. Some of it can be postural too.
If somebody has a concern, where do they start? Pediatrician's office?
Great. Pediatricians are the mainstay of referral practice for my patients with scoliosis. They're constantly screening the kids. It's happening more in the office now than I think the school. So yes, I start at the pediatrician, or any orthopedic or pediatric spine surgeon would be always happy to see.
And if there's a key age where you ought to ask the pediatrician to check on it, what would that be? I'd say any time during growth, or if you happen to notice an abnormality in your child, some sort of asymmetry. Dr. Kelley Banagan with the University of Maryland Orthopaedics Department, thank you for being with us.
Thanks for having me.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.